Welcome to another exciting show of Warriors United for Christ. What a day.
We are already there. We're already in there.
And just to let you all know, we still love God. Thank you, Jesus.
Hallelujah. He's a good God. He's
Before
the
we
great
get started,
I am.
He's an on-time God.
Oh, yes. And look,
Before we get started, I want to say this. I want to give God thanks for the outcome he gave me today at our proceeding. It's been 4 years, but we finally got it where we settled. We have to pay something. They have to pay something, but you know what? God is good. We just thank God that it's over because I couldn't take anymore. I thank God for the blessing. So God is good. All right. How was your weekend, gentlemen? How was the week?
Does that mean he can pay for our next foot golf session?
that's what it sounds like.
Okay.
You're gonna make it rain. Make it rain.
No one said, I said, we had to pay. They had to pay. How was your weekend, people?
Oh, my weekend was great. Commanders won. Man United did an excellent job in their game. So I'm good. I'm happy. Commanders won. Dallas.
Oh, my turn? Oh, my bad. Okay. Well, the whole of America already know that the Ravens won also. We demolished the Squealers. I'll let you all know that right now. The Squealers. Yeah, we demolished them. But let me say this first. Last Monday, I forgot to say, it was my son-in-law's birthday, Eric. It was his birthday last Monday.
Ooh, you're in trouble.
And I forgot to say, no, I'm not in trouble because I got to babysit his children. But anyway, so I'm not in trouble, but I do apologize. But it was his birthday last week, so happy belated birthday. I know you had a good week already, but I forgot to say it last week. But yeah, the weekend was nice.
All right. Well, it was my sister's birthday. One of our viewers, Deborah Johnson, it was her birthday on Friday, so we wish her a happy birthday also. So we clapped her also. And my weekend was great. We had a function at our church where the Jamaica Organization for New Jersey, they installed all their leaders during our service. So it was awesome. We ate food afterwards. It was a great time. I'm shouting them out if any of them come watching. It was a great event. So I'm so glad that we had it. Now, gentlemen, the question that I have for you, who now wins, the Eagles or the Commanders?
Well, I'll put it this way. I just want Minnesota to take out the Eagles and everything will be okay.
Not happening.
But wait a minute. No. Minnesota have to play tonight.
Right.
They play the Rams tonight.
Right.
So whoever do. But the Eagles are not going to the Super Bowl. They're not going.
It's a tough one to call.
No, they're not going. After watching them struggle.
We'll see.
They always struggle, though.
We'll see.
But
it'd be just like that. Bing on the goalpost again.
It's the
Bing.
playoffs. It's different. Yeah, that was so funny.
Bing.
That was so funny.
I know you heard in New Jersey, didn't you? Bing.
We saw that. But remember, Tucker did that against Detroit.
Okay.
When he kicked his 66-yarder, the longest field goal in history, and he gave bing,
see,
and then went over. But look, as long as they go in, everybody's happy.
Everybody's
all
happy.
That matters. It's all that matters. And then
all that matters.
Yeah.
You know,
but before we do any more,
what is this? What is this?
Foot golf.
But you got to say what you got to say.
Saints of God, especially those from Pastor Johnson Church. Listen in.
Yeah.
Push the button and subscribe. Like us and share us with everybody you can in your family and your friends to the Warriors United for Christ. Well, fee, but it's for. But we, you understand.
Right.
For Christ, we love you all.
Right.
Continue, especially those who's on right now. Thank you. We love you.
So, Rupert, question for you. Have you ever gone to the doctors and you weren't happy about the diagnosis you received? Or have you actually went on the internet to try to figure out what the doctor was talking about?
That I have done. I've definitely went on the internet, WebMD, to see what I was feeling, what thing came up. And of course, it was like 14 different things. So I chose one. So, yes. And then I went on to the doctor to see if I was right.
I've done that too.
Yeah, no, because my right shoulder was hurting, and they checking my left. I'm like, what are you doing? I didn't say that. I mean, typed it in. What are y'all doing? You trying to hurt my shoulder?
but yeah, we're gonna get into it. But I did the same thing, and he says, "Well, I'm checking your other shoulder because not a time it's a nerve issue, and it's not in the same shoulder you're thinking you're hurting. It's something else going on." And I was like, "Whatever you say, man." But I did the same thing, yeah.
But if he had touched my nerve, my hand would have shot up and hit him. Because it would have been the wrong one.
Well, tonight, let's try to have some of these questions answered.
What?
So tonight we have a professional, Dr. MD himself, Dr. Edward McNiel. God bless you, sir. Amen. Amen.
He's a professional, right?
He's a professional.
But not in computers. I thought I was Dr. McNiel. Look, I thought I was bad. But you made me look good.
I said, Doc, click the link. What do you see? He said, I see the link.
That's okay, Doc. Now, everybody knows computers, so it's all good, sir. It's all good. But look, you're here. You made it in that 2-minute warning.
And I can tell you this, I'm happy. I'm happy.
We're happy too, sir.
I don't care about the computer that way. You guys need a computer. I want the paper and pencil.
But you want the computer. You needed it tonight.
I don't need it. You need it. Trust me.
So, Doc, tonight we're going to be talking about misdiagnosis, things of how you can go to the doctor and tell you one thing and you don't know what they're talking about. And a lot of times we tend to go out and try to diagnose it ourselves, or we do WebMD. So we're just going to come right and ask some questions, and you can help us answer some questions, put a lot of stuff, those misnomers to rest. So, Rupert, what do you want to start off with, sir?
I'm going to start off with this. Doc, tell me how many people come into your office, or how often do you get people coming to your office telling you what's wrong with them before you even take a look at them? Do you get that often?
Most often. Most often. And the reality is the higher the level of education they have, more information they come in with. I mean, they have magazines, they have journals, and I've read this and I've read that all the time. Yeah. But and I'm saying this, if there's a college degree or higher, you could be in trouble. And there's also a preference regard to ethnicity.
Really?
Oh, absolutely. Absolutely.
Which is the worst?
This is absolutely the truth. For some reasons, and you're just gonna have to walk with me on this one, because this is the truth. The white population will come in much more knowledgeable, with more questions and more information consistently. Because at one time my practice was more, I had probably 40% white females, 30% black females, about 20% white men, and only 10% black men in my practice. There were times when people thought I had a female practice because there were just women, very few men. But that's what you would expect, because black men really don't come to the doctor that often. Right. They don't seek care. They just don't seek care.
Right.
Black women, probably 3 times as much, if not more. So really, they will come in telling you.
Women with the questions, Doc? Is it women that mostly have the questions, or the men?
Women,
I mean, the answers.
The women will come in with the questions. The men, you can tell the men anything. The men are not going to come in with questions. They want a quick fix and they want out of the office. They want a quick fix. The men are not going to go online trying to find out anything.
Really?
No. The ladies come in. They come in with the Wall Street Journal. They come in with all kind of health magazines and just prepare yourself.
I guess I'm part of the 5% because I go online and check.
Well, that's what I said. The higher degree of knowledge and education, the more people are going to come in, because it's something about participating in your care. When people participate in their care, they do a better job in terms of compliance and taking their medicines and caring about the costs and those kinds of things. Whereas people that really don't participate before they come in typically are the ones that I struggle the most with. in terms of following instructions and doing what you ask them to do. You can tell the ones that are going to be engaged, that are going to be engaged.
So why do you think men have an issue going to the doctors?
I think it's more society. You know, men see themselves as being strong and not vulnerable, and you know, men are just powerful beings, and it's a sign of weakness and all of this kind of stuff. And men are, and I don't know if some of you all can think of it, men seem to be more afraid of shots and exams than the ladies. The ladies just come in, whatever I need, just give it to me. The guy comes in, I don't want the shot. I don't want that prostate exam, and they're squealing all over the place.
Well, come on, Doc. Truth be told, things supposed to go out, not go up. Come on now.
Doc, I will tell you, Doc, needles scare the heck out of me, man. I close my eyes. I can't even look at the needle. I'm like, don't tell me no countdown, no 1, 2, 3. Just here's my arm. I'm closing my eyes and poke me. I don't want to know.
Oh, I have no problem with needles, bro.
I have no problem with no needles.
If you look at the data, there's reason men have the shortest life expectancy. Black men have the shortest life expectancy in this country. And you guys haven't. Well, I don't know about Simon. I don't know how Simon is, but I know you other two guys are pretty young. But
he gonna be dumber, sir.
No, wait a minute. No, back up. Whoa, stop right there. Stop right there. Stop right there. Indulge me in what you just said.
I've already passed the life expectancy for Afro-American men. I've already passed that age. Okay. So I went online this morning. I got it this morning. I said, well, let me see what percentage of black men live past life expectancy of 69. And they told me they had no data. I couldn't find no information on it.
What?
Really?
Our life expectancy is 69?
69?
Yeah. But I thought men as a whole was 85.
No one lives 85 in this country, I think, except maybe the white female, average life expectancy in this country. Yeah.
So
I think the black female is probably around in the 80s, maybe 80 to 83. The white male is about 76, 77. But the females, black and white females, are in the 80s. But I think the white female is probably 85, 86. But everybody else, the black male is less than 70.
Okay, I understand that part. So what if you're mixed?
There's no data.
For mixed people? I mean, black and white?
Take the average, man. Take the average. Average between black and white. So 80, what is it, 70, 69? You're about 73, bro.
If you look at places like Loma Linda, California, which is considered a blue zone, the life expectancy is probably about 90. If you look, and a lot of the variables are there. If you look at, for instance, the North and the South, you know, I'm in the South, and clearly, you know, according to the data, I should live on an average 10 years longer than you guys, just my presence here.
Really? Why is that, Doc?
I don't know. I think there's so many variables involved in that, but I think the hustle and the bustle, you know, down here we have all the trees and the greenery and all this stuff, and it's so many things involved.
So you think this might be stress levels? Because I know it's quite stressful in the Northeast, where the South is not as stressful.
No. Everything is laid back. You see, I couldn't get on the computer, right? Laid back. Give me pencil and paper. You know, get this after a while.
So what you're saying is the less stressful environment will increase longevity.
Yes, because what happens with stress? Stress, you know, when you have stress, you have a lot of cortisol. Anytime there's a stress response, you have a lot of cortisol in your system. And cortisol does everything wrong. Cortisol increases your blood pressure. Cortisol increases your chances for diabetes. It increases your weight. You know, it puts more workload on your heart. Because, you know, when you're stressful, you know, it's like the dog being behind you. But you don't want to live under that kind of environment for any length of time. But some people live under that environment for long lengths of time, sometimes their whole life. And even when they're asleep, there are people when they're asleep. In fact, they're looking at why Afro-American men for so long had difficulties with high blood pressure. But most of us, when we fall asleep, the heart rate goes down, the blood pressure goes down. But, you know, they did some initial studies, and they was trying to suggest that even during sleep, the stress level would help. The stress level would continue to stay up. So there's a certain amount of what we call tonicity, tightness of the blood vessels, even while you're sleeping, and a little more rapid heart rate than you would expect to have.
So Doc, the sleep thing. So what would you say to a black man? How they should they do something before they go to bed? Should they,
No. If I had to give anybody one piece of advice, just one piece of advice, and what I think is probably the most valuable piece of advice, it will be just to stay busy walking. I think the more we're engaged walking, the better we're going to be. Not going to the gym, not running the track, not jogging, but just walking every day. So people talk about 10,000 steps. Well, how about 15,000 steps? How about 8,000 steps? But I think just the mere fact, because if you look at the blue zones, yes, the diet is good. The diet is extremely good. Some of these people are vegetarians and some are even vegans. But the thing they walk. They're always busy. They're always engaged, and they understand relaxation. And that's the piece we're not missing. We're not missing relaxation. We're missing relaxation, and we're missing the busy piece. We sit all day in front of computers, and we're not really active enough. We're not. So my number one recommendation would be activity. We've got to turn up the level of activity.
So when you speak of walking, what about those who may have joint issues or things like that prevent them from walking?
Well, I'm gonna say this. That's why we need to get away from. I'm going to say this. Part of the issue with the joints is the weight. Part of the issue with the part of the issue with the walking is the joints. Well, that's from the diet. Most of the stuff that we see is diet oriented. It's absolutely diet oriented. I'm going to say this while I have you guys on the line. I've got this press time, and I'm having to pay for it. When you look at churches, the Seventh-day Adventists have the longest life expectancy of most churches. And they're in Loma Linda, California. So when you look at Loma Linda, California, a big section of that territory is just congregants of the Seventh-day Adventists. These people are vegans and vegetarians, and they're not packing their belly full of meat, sausage, and hot dogs and hamburgers. They don't eat that way. And they're up in the 90s with life expectancy. They're up in the 90s. Because they take care of themselves that way. They take care of themselves. We say we know the truth, but they're the main ingredient for me that's missing in most Americans in this country is discipline. There's just no level of discipline when it comes to our eating, when it comes to our level of activity, and even if we know the truth, there's still no discipline.
Yeah. So what Mark was saying. So the joints. Yeah. Now I know that from the time I was 5 years old until even now, I did sports, a whole lot of sports, everything. So when they looked at my knee, it was worn.
Right.
So that had got nothing to do with weight, because
I had no issues. It has more to do with your diet. It has more to do with your diet. So because foods are inflammatory, foods create an inflammatory environment. What we eat, sugar, for instance, it creates an inflammatory environment. So what is sugar? Sugar is not sugar the way you think sugar is. Sugar is rice. Sugar is bread. Sugar is macaroni. Sugar is pasta. Because the final breakdown product of all these things is sugar. Meat creates, unless you're eating salmon or fish or sardines, which are anti-inflammatory kinds of things because they have a lot of omega-3 fatty acids. If you're eating things that create inflammation in your joints, you're going to have problems with your joints. It's not the wear and tear that people think it is just because you've been doing something for a long period of time. There are people who've been very active their entire lives and they have no arthritis because their diet isn't that way. I walked in to see a patient one day. He was 58 years old, and he had a massive stroke. And this is a true story. And two ladies were in there taking care of him, and they looked relatively old, but they were very thin and very spry, moving about in the room very quickly. And I came home and I told my wife, I said, baby, I went to see one of my patients. He had a massive stroke, and these two ladies were in there taking care of him. And I said, man, they were thin, but they look very healthy. She said, they're Seventh-day Adventists. So she said, you asked him tomorrow. So tomorrow came, and I went back in, and they were there again. I said, ma'am, I'm not being intrusive, but my wife seemed to think that you all might be Seventh-day Adventists. And the lady looked at me and says, we are. She says, she was 92. She says, I'm a vegan. And she says, this lady's 86 and she's a vegetarian. And she said, this guy who's 58, said he's Baptist.
I wasn't ready for that, Doc.
Okay.
So this is what I'm talking about. See, I knew Holly was going to come and say, we got a couple comments, but before we get to them, this is what I was talking about, the right diagnosis, because like, just Simon just said, oh, it's my joints, it's the sports. I used to think the same thing. I used to think that, with sports, I played a lot of sports.
But you can develop
a diagnosis for me why my joints, why arthritis, but you're saying it's not. You're saying
it's not. I'm not saying it's not, but I'm saying a lot of people are very active and they have no issue. Yes, you can develop something called traumatic arthritis. Traumatic arthritis is just from trauma. Just as you said, playing sports, just trauma on the joints. But there are a lot of people who do still participate in sports and they don't develop the traumatic arthritis. The body has such resilience and such an ability to rebuild itself and restore itself. I mean, just tremendous. I mean, we're wonderfully and we are perfectly made, and these bodies know recovery, but they only know recovery when we're doing the right things to recover them.
Does that collagen stuff work?
Oh, no. It probably only works if you're very early in the process. So when most people decide to turn to that chondroitin and all of that stuff, when they decide to turn to it, they're so far down the course of things. It's like Abraham and Sarah. You're going to need Jesus.
You're going to need Jesus. I think someone says that of it.
Well, Doc, that brings me an interesting point, because you often hear the term in the medical profession that they're practicing medicine.
They are practicing.
So that means they don't always know the right answer.
That's correct. That is correct. I'll applaud that.
Okay.
Yeah. And it's true, because medicine is, and I meant to look up a quote, but I don't have it in front of me now, but I can't even think of the guy's name, but he was considered one of the fathers of medicine. But the point of what he said was this. He said that medicine is more of an art than it is a science. So what happens is everybody believes that medicine is 1 + 1 is 2, and medicine is in that way. And the reason medicine is in that way is because, number one, there's so many diseases. Okay, so what is that number? That number is over 10,000. So let's look at 10,000 diseases, and not only look at 10,000 diseases, let's look at the symptoms, which so often are overlapping symptoms. So what are overlapping symptoms? You come in and you tell me, oh man, I'm running a fever and I got some muscle aches and joint aches. I'm having a little bit of headache. You know how many things can cause that? Mm-hmm. Yeah, so you have overlapping symptoms, but you have to be careful, because there's a danger when you look at overlapping symptoms. So if you come and says, I have, for instance, I've been having chest pain off and on. I'm having chest pains off and on. And the first thing I say, oh, well, tell me what you've been eating. And you tell me, well, I've been eating spaghetti before I go to bed and all this. So the first thing I'm going to say, well, you're having heartburn.
Heartburn.
Okay, heartburn. Okay, because that's overlapping. Those symptoms are sort of overlapping for chest discomfort at night, eating this and laying down. So you got reflux or heartburn. Well, watch this. 2 days later, you're in the emergency room having an acute heart attack. Because they're overlapping symptoms.
So okay, my question then is, okay, because when you say we have a wrong diagnosis, so when they give out prescriptions of medicine, it always seems like they have one for whatever your ailment is, but then there's another 5 that says you may get by taking this medicine. It could be a heart problem, a lung problem, or whatever. So you taking it for one thing, but when you read it, it might give you problems with your kidney, this.
And it's true. And it's true. Because all these medicines are chemically made. These are not natural products, and even natural products can cause issues. But when you look at drugs and things that are chemically made, I participated in multiple studies when I was in medical school. And the studies are very, very simple. I hate to say that, but it's simple. They give us medicines, or they give us something that says, fine, I want you to take this for the next 10 days, take it this time of day, don't eat this, and whatever, whatever they tell you. And then if you develop any symptoms, you are to write it down. So if I have a headache, I have to write it down. Okay, if I develop a cough, I have to write it down. There's nothing scientific to say that caused it. But it has to be listed as a side effect. It has to be listed. So what happens? We look, maybe only a few people, maybe. That's why you see sometimes it says maybe 2% chance of causing this, 10% chance of causing this, 20%. Yeah. It's based on the number of people that reported it. I'm going to show you side effects. Watch this one. Okay, when they first put Viagra on the market, I'm going to talk about something you guys probably know a little bit about.
Doc, thank you, sir.
Yeah, I'm gonna help you tonight. So when they first started looking at Viagra under investigational purposes, they looked at it for high blood pressure. It was never put out for anything other than high blood pressure. And what they found out is that it wasn't very effective as the antihypertensive medicines that we have on the market. It was never put out as something for sexual dysfunction. It was only investigated for hypertension. Only.
Wow.
But when they found out it was failing for high blood pressure, they asked for a recall on it. So they called all the ladies and the men and says, okay, everybody needs to turn what you have left, turn the medicines back in. So who didn't turn the medicines back in? The men.
The men.
The men didn't turn the medicine back in.
We know why.
Why?
And so they asked the question, and that's how it came about. It was a side effect. So when you start talking about side effects, Viagra came about as a side effect from a medication that was being investigated for hypertension. Nobody's complaining about that. I don't see anybody complaining now.
Anyway, before we carry on, because it's really getting hot in here. No, before we carry on, we got let the people know. Continue to share, like, and subscribe. Press them buttons and keep going, because we're gonna have to go to these questions because they coming up. So and their thoughts. So you got some more questions to answer, and hopefully it'll ease down some.
Hello,
this is our scripture serving brother right here. Hello, family. Many people have died. Oh dear. Let me say this slowly. Hello, family. Many people have diagnosed me with the things that are wrong with me. But the Lord said, by his stripes, I am healed.
Amen.
True, Dexter, true. But you better go to the doctor to make sure you find out what you need to pray about. All right?
Amen.
Hey, welcome.
Well, Lawrence, good to see you, sir.
He gonna tell the truth.
It says, Doc, I'm scared of needles. But I do what I have to do to stay as healthy as possible.
Yes, sir.
He has to get back out on that cricket field.
And plus, he's Jamaican, and Jamaicans are generally scared of needles.
Hey, man.
You are. You just said you are.
I am. What you got to talk about is being Jamaican at that.
Well, hopefully they're watching.
So Esther says, and welcome, Esther. Thank you for joining us again. She says, clap hands, our mobility and activity. The body is designed to move.
Amen.
So, Doc, based on that, what are the top 3 things? You said walking. We should move by walking. What else should we do?
I think clearly we have to watch our diet. I mean, clearly we have to listen to our bodies. You know, I think we tend to eat too much, and we eat too many of the wrong foods. I'm going to say that, too many of the wrong foods. I think the diet has to be packed with greens and vegetables and fruit. And those are the things we're not seeing. At the run of the day, most people eat maybe 1 or 2 fruits, maybe 1 or 2 vegetables, maybe that. And the numbers should be much greater than that, to be honest with you.
Well, I tell you, I'm one out of those 3. I love fruit.
Mm-hmm.
Other 2 I'm working
on. Love them all, man.
Yeah. There is, the only thing that keeps us healthy are the vitamins and the minerals. The vitamins and the minerals, those are the things that, build up our immune system. And those are the things that keep us strong and develop tissue and muscles and things. So if we're not taking in the vitamins and the minerals, then let me show you. If you're eating French fries, for instance, French fries is just a bad food. It's fried food. It's just, there's just nothing there that's healthy. And they'll tell you it's the most frequently eaten vegetable, but after you fry it, you have killed the potato and you've killed yourself. If you look at a hamburger, how much nutrition is in a hamburger? How much nutrition? None. There's no nutrition in a hamburger. You're making some amino acids, but it's just a nasty meat that's been subject, to. I'm going to be off of the side show so I can say what I want. It's a nasty meat.
Go ahead, sir.
And it's subject to all kinds of hormones and antibiotics and you name it. Things that we're introducing into our bodies.
Right.
I mean, you got growth hormones from the cow that you're consuming. You got steroids, and then we're consuming those things. There's no way those things will not have some impact on you. They're going to have tremendous impact.
I was wondering why I kept saying moo as a kid. I kept going moo.
Well, that's why I often wonder why humans drink cow milk. I mean, come on. Why?
There's really no real reason, because number one, we don't break down cow milk the way that
exactly.
the calf breaks it down. Okay, there's something called casein, casein in it. So we don't really break it down that way. If you look at how God created the earth and the world and the animals and everything, the pig takes the cow milk, and the pig takes the sow milk, and the kitten takes the cat's milk, and the puppies take the dog milk. And for some reason, instead of our taking the mother's milk or the mommy's milk, we take the cow milk.
Wait a minute. We can only go so far with the mother's milk. Come on, man.
As far as we can go, but we're not going any length. We're not going any length.
It's not because we don't want to. It's not because we don't want to.
So okay, I'm gonna let you have a pass on that one. But now I'm gonna go to this point. I'm gonna let you have a pass, and I'm gonna take the pass back from you. Watch this. Okay. Now I'll give you the pass that up until 5 or 6, yes, you can have it. Now, why are you still drinking it and you're 12, 14, 25, 45, 55 years old?
But drink milk?
Milk.
Okay, so when I was brought up,
I'm not even trying
I'll tell you. In fact, when I was being brought up and playing sports, they were saying you drink a lot of milk, and it'll help you with your bones. This is what I was saying. I'm not saying it's true.
I agree.
Okay. So
that was
you
bad.
drink a lot of milk. So I mean, I drank a lot of milk.
Bad
yeah, exactly. But at the same time, he says it'll give you strong bones in that. I've never in my life ever had a broken bone. So I can't then
It has nothing to do with the milk. Trust me.
Milk.
Yeah. Oh, let's get some more. Let's get some of these things in. Hold on.
Wait.
Let's get that one. Okay.
Just come on, man.
What do you do if you can't have the fish in your diet?
Oh, man. I would cry. I would
cry.
Yeah.
I got to have a fish, man.
I'd get a lot of Kleenex. I own some shocking Kleenex.
Come on now.
Oh man, because I'm telling you, that's hurtful.
Yeah.
When it comes to meat, that meat is more precious in our system than any other meat. It's the same meat that the Lord fed the 5,000 with.
That's right.
Yeah, same meat. And fish has so much goodness in terms of everything from vitamin D, calcium to omega-3 fatty acids, all the anti-inflammatory stuff we can find more in salmon, probably salmon and sardines. Oh my goodness.
Yeah.
Those are just good things to eat.
Some sardines tomorrow from the store.
When you're struggling to have meat, can't have meat in the diet, then you have to replace that with something else. Now, meat, all those meats, including salmon and sardines, are a source of protein as well.
Right.
So I'm going to say this. One of the things that I would be consuming would be nuts. And all nuts are not the same. All nuts are not the same. We may think all nuts are the same, but all nuts are not the same. Probably if I had to say what nut is the worst nut, I would probably say the one that we love the most, cashews.
Don't tell me that.
I know you
were going to say that.
My favorite cashews and pistachios, man. Cashews and pistachios.
Yeah, there's a reason.
Hold up. What is wrong with cashews?
We don't even think it's a nut. We think it's probably a bean.
Well, beans are good for you too.
Well, the problem with beans is that if you don't cook beans, beans are good. Beans have something in them called lectins. Yes. And if you don't cook beans good and cook them down, these things tend to affect your gut and cause some issue with the gut and things that can actually be absorbed in the intestine. But nuts, for the pistachios are good nuts. Almonds are good nuts. Walnuts are probably one of the best nuts. Even macadamias are pretty good.
Okay.
So
they give you a food that has anti-inflammatory properties. They give you omega-3 fatty acids. It gives you calcium, for instance. We'll talk about milk for calcium. So what about collard greens? Yeah, calcium. Yeah. What about sardines and salmon? Calcium and vitamin D. So there's a lot of things that gives us calcium and vitamin D. Almonds.
Man, you just threw me off.
It's not just milk and
cashews, Doc.
Okay, for the bones.
But see, a lot of times people
for brother Ed's question though, what if
fish?
You can't have fish, right? What could you replace it with? Nuts.
Eat your fish.
I think I would look at nuts as a source of protein and a nut as a source of omega-3s. Obviously, if you can't have fish, but you still can use the olive oil and things like that. But it's tough when you can't consume fish. Yeah. It makes your diet tough, very difficult, especially if you're somebody who really want to be healthy.
Someone's talking to Rupert. Someone's talking to Rupert.
I said back here, I said, hi, I don't say anything.
Oh, you
gave me this one.
Too late.
Rupert. Yeah.
Behind that, Doc, is that Holly said that Rupert should be a vegan, and he's like,
I'm going to say this. Anytime you eat anything that's farm raised, you're in trouble. Okay, you don't want to mess with farm raised anything. If you're going to eat salmon, it has to be wild caught.
Because tilapia is farm raised.
Yeah, but that's probably one of the worst meats you can eat. And I know people tell you it's not, but it is. Praise God.
Wait, tilapia is one of the worst too?
One of the worst fish.
Really?
Why? Because the bottom feeder? Why?
Well, maybe some of that, but in terms of the good fats and things that are in them, the omega-3s and all that, it doesn't have as much. And you look at farm raised, the farm raised animals are fed differently. When I say they're fed differently, they're fed this way. They just feed them corn, for instance. Well, corn is an inflammatory food. Everything we eat is corn. Everything we eat is corn. The sodas are made from what? Corn syrup. Popcorn is what? Corn syrup. Grits are what? Corn. Everything we eat is corn. The little dabs that you eat has corn. I'm talking about the little honey buns and nutty buns and all that stuff, all packed full of corn. Corn is an inflammatory food. If you want to get off of something, if you want to fast, you guys want to fast off corn. I bet you won't be eating anything.
So you mean I can't have grits anymore?
Grits?
I'm just saying you can eat what you want.
But
I'm just saying you're going to have inflammatory joints. You're going to be hurting. You're going to have coronary artery disease. You're going to have all kinds of other things. And I'm going to be sitting around with my feet up.
So what's the life expectancy for a Latino? Because corn is all in their diet. So what's the life expectancy for a Latino then?
Say again?
What's the life expectancy for a Latino individual, and how are their bodies? Because they're 100% corn.
I don't know that. I can't tell you their life expectancy. I can tell you that, and I'm not sure what encompasses the Latino population. If you can give me a little more, I don't know. That's not the Mexicans, are they? Is it?
Yeah, Mexicans.
Okay, so let's talk about it then. They tend to, if you look, they have what we call
height problem.
There's a syndrome, but I can't even put my hands on it now, because you look, they have the short stature, but they have the stout bodies. So they have a very high incidence of diabetes and called metabolic syndrome. They have something called a metabolic syndrome where they are really prone to a lot of chronic illnesses. Even though that's the bulk of their diet might be corn. I don't know what their diet is. I'm just going.
A lot of it's corn. Yeah, the bulk is corn. Like you're saying, the tortillas,
But they have a lot of metabolic syndrome where they have a lot of chronic conditions and things that's predisposing them to heart conditions, etc.
Wow. Okay.
Yeah, Deacon Lied, he's asking, are the seated pedal exercises effective?
Well, we do some things that look cute. I say we do some things.
You're walking sitting down.
And that's one of those things we do to look cute. Because I'm going to tell you, there's no way sitting there moving your feet on that little pedal is doing much. And let's talk about why. Because in order to live long, I say you have to stay mobile. But you have to stay mobile, moving large muscles. Okay, large muscles. Not the little hand. You can get those little things you squeeze your hand with.
Yeah.
Start today and squeeze them till Jesus come back. You won't live long. You'll be dead soon. You won't see it. Because you don't create cardiovascular. You don't create cardiovascular effect until you start using your larger muscles. You got to use your thighs and your legs. You got to move your body. So those things may be good to help your feet and your ankle, but it's not helping your overall health. Not at all. Not your overall health. Maybe.
So I think they're asking this question also is because if your mobility is not really that good, and
you need to do whatever you can do. I agree. Yeah,
okay.
I will agree. And that includes you have to crawl around, because crawling around is going to create more activity. It's going to increase your heart rate. See, some things we don't want to get down, but there's a posture that God wants us in sometime. Okay.
Okay. But you're saying that
I have crawled around on the floor when I couldn't get around. Crawl from one room to the next. Crawl because I knew that was going to give me more activity and more usage of large muscles than just sitting there doing this with my feet.
But I think what he's asking for is like the bike, the exercise bikes or things like that. Where you're using that's what I think he's asking.
Bike is good because you're using the larger muscles. And
well, I know the equipment he's asking for because it is just
the bike will reduce the trauma on your joints.
Because what he's saying, it's just a pedal thing.
And your back.
Okay.
It's the way to go. It would be the way to go.
So again, our producer is wrong. It's because we already took the milk. So, you got milk. It's just a marketing by the cow lobbyists. It's the chicken lobbyists that are marketing the milk, not the cow lobbyists.
Esther goes, how much truth is there to medicine being driven by the insurance companies and pharmacies? Do they want us to be dependent on drugs for financial gains?
They do want you to be stuck on drugs.
Oh, yeah.
Yeah.
Because there's not a lot of investigational stuff going on except for medications, not necessarily to cure illnesses. And that's the problem. Nobody's trying to figure out how to cure most of these illnesses. The only thing they're trying to come up with is medicines which will never get rid of these illnesses most of the time, but to mitigate these and to make them more tolerable. And then they charge an arm and a leg for the medication. But it's all driven. It's all financial driven. It has to be. What they charge for some of the, and I'm going to show you why and very quickly here. I do mission work, a lot of mission work. And I buy medicines buy the boxes, big boxes of medicines. I can get medicines from third world countries. And yes, they may be generic, but in order for medicine to be generic, it has to be 75% bioequivalent to the brand name medicine, just 75% equivalent. So it has to be within 25%. So it can be 25% short or 25% large. But let me say this. I can buy, for instance, everybody knows amoxicillin. I can buy 3,000 amoxicillin tablets, 3,000 tablets for less than $100 and take to me on a mission trip. I can buy 5,000 amlodipine, which half of the people on this line listening are taking. I can buy 5,000 of those tablets for less than $100. And you can't buy 30 hardly in this country.
That's right.
Mm-hmm. Yeah.
Wow. Wow.
We talked about this one. Wild caught.
Yes, the wild caught is the best. The farm raised we need to avoid at all costs if we can.
Farm raised not good.
Not good. But I'm telling you, corn is something we all need to look at. And anytime you see corn in anything, you have to be careful.
What was that? Yeah.
Corn syrup. Corn syrup. Yeah, corn meal, corn anything.
Mm-hmm. And someone said there's too much conflicting information. We've had no conflicting information tonight.
None tonight.
None whatsoever.
But I think, for instance, like one day you'll get this causes cancer, and you say something else will not cause cancer is good for you. Then suddenly you get. I think we're talking about. Some people said that the corn was good for you. Now corn's no good for you. You know, and so I think
corn is on. No, it's not that corn is good or bad. It's like anything else. If you have too much of anything, it may weigh against you. Corn is one of those foods. You have omega-3s, omega-6s, omega-9s. Some are anti-inflammatory. Some are, omega-3s are anti-inflammatory, but 6s and 9s. There has to be a balance in what we're looking at when we look at those. The ones that are mitigating and the ones that are causing inflammation. So what happens is this. We're way off on our balance. Our balance is way off. If you tell me you're eating 2 strips of bacon and you're eating 2 oranges and a grapefruit and some blueberries with it, then you know what? I might let you have the bacon, but that's not what you're doing. You're eating 2 strips of bacon, you're eating a fried egg and 2 pieces of toast.
Isn't that called lies?
That's called a sandwich, but hold on.
Yeah.
Doc, though, so the same way when I say to you about computers, when you say to us, omega-3, omega-6, omega-9. I'm thinking doing a football play. Explain to us what is omega-3, omega-6. What kind of thing is that?
These are fatty acids. These are what we call fatty acids in the body. I'm going to say that they're fatty acids in the body, and the omega-3s have a greater tendency to shut down some of the inflammatory response that's going on. And so most of what goes on in our body is inflammation.
Yes.
We have heart disease because of inflammation. We have arthritis because of inflammation. We have skin diseases because of inflammation. There's two words that I think that people need to put their hands around. One is inflammation and one is oxidation. Inflammation and oxidation, because that's what's going on in our body. That's why you always hear the word what? Antioxidants. They say blueberries are antioxidants. This food is an antioxidant. Or they'll say this food is a omega-3. If you look at the antioxidants and you look at the omega-3s, those are the things that's shutting down disease in our body. They're shutting down disease. Yeah, because oxidation is a process we don't ever want to be, we don't get engaged in. But the whole oxidative process goes on all the time, and it creates inflammation. So look at oxidation. I put a piece of wood in the yard today, and I come back 6 months later. What's wrong with it? There's no life in it. Mm-hmm. If I cut a tree down today and lay it down in the yard, what happens? 6 months, 12 months later, there's no life in it because of oxidation. But if I leave the tree standing and don't take it away from its base, it doesn't oxidize that quickly. Mm-hmm. The things we put in our body promotes oxidation and promotes inflammation. That's why when you eat sardines calm down those processes. Salmon calms down those processes, but not corn. But there still has to be a balance of them. And the balance is way, way off.
Well, Doc, you just said something that made me ask this question. When you spoke about the heart disease and so forth, so why is it they always ask this question? Does someone in your family have this? They try to make it seem like it's hereditary. So how is that hereditary if your diet can be one way and theirs was another?
Mm. I'm sorry. Say that again. I'm sorry.
So how can it be hereditary when your diet is one way and theirs is another, but yet and still you may have a heart disease like they had?
When we say something hereditary, we're talking genetics. It has nothing to do with what you're doing. It has nothing to do with what you're doing. You're predisposed. So let's use the term predisposed. So you're predisposed. So because your mother and your father both have diabetes, you're going to have a high predisposition to develop diabetes. Not that you will, but there's probably a 90% chance you're going to develop type 2 diabetes. Not that you will. But what it does, it puts you in a posture where you can do something about it. But we don't, because we accept what they say. Once they say your mother and father had it, you're most likely going to have it. We receive it. We receive it. Instead of going to the gym, instead of going to the ground, instead of hitting the track, instead of getting out, instead of modifying the diet, we just continue our routine. When you know there's a predisposition of diabetes or high blood pressure, the first thing you need to do is work on your weight. You have to work on the weight. The weight is the predisposing thing when it comes to type 2 diabetes. Mm-hmm. I don't care what you're eating. It's still going to be the weight. You might be eating all vegetables and fruit, but if you're eating so many that you weigh 250, you're still going to be diabetic. It's a weight issue. Yeah. So you have things that we are predisposed to. We have to work on those things.
So far, Doctor, you've said everything that I am. So I had to lose weight because I was type 2. So I lost the weight. I have to be exercising. So I think a lot of it is the lack of knowledge for us, but also the fact that sometimes we think, like you said, we are invulnerable. We are invincible. And that we can do anything. Like for as long as I was like, I'm good. I used to tease everybody. It's like if I don't know I have it, I'm never going to get it. I used to say stuff like that. And I think we have to realize that this stuff is out there. It's real. Like my doctor said the same thing Mark said. A lot of things are hereditary. He said, if your mom had it, give a chance of getting it. So don't. Because
you cook like your mom. You eat like your mom. You look like your mom. It ain't just you just look like your mom. Your eating habit are like your mother's eating habits.
Yeah, you have to be careful. Right. And so that's what I think was part of, me saying, okay, now I have to worry about it. But when he said I'm pre, I never thought about it.
Yeah.
And I think that's the problem that we hear pre and we're like, oh, we're still good. When you hear pre is when you're supposed to be really doing something, not after you get it. When you hear pre is when you should start saying, okay, I got to do something so I don't become it. But I think a lot of us miss that.
So what's the value of drinking and how much water should we drink? Because we know that's important.
I'm going to say this. Most people are probably dehydrated.
Mm-hmm.
I'm going to say most people are probably dehydrated most of the time because we're not drinking enough water. And we're so mixed up about what to drink. We think if I drink a soda, that's the same as drinking water.
No, we know that's not.
I know that's.
If I drink tea, it's the same as drinking water. Tea is good.
No.
But it's the same. It's not like a soda because it has antioxidants in it. It's going to promote long life and longevity, but it's also going to promote diuresis or urination. So that's the problem with tea and the drinks. But when it comes to how much water, people say 8 ounces or 6 ounces, and probably the best way to look at it is what is your weight? You have to look at the weight when you start talking about how much is somebody going to drink. I think if you weigh 150 pounds, you may need to drink 150 ounces a day. You know, I think it got to work at what pounds, what is the weight in terms of how many ounces that we should be drinking. But I think in terms of the amount of water, we know when we're thirsty. Let me say that. We know when we're thirsty. We know when we're not urinating. We know when the urine looks the way that it shouldn't be looking. If it's looking dark, you're probably not drinking enough for the most part. If we were thirsty a lot, we're probably not drinking enough for the most part. You know, whether you're drinking 6 ounces or 8 ounces, I think if you're drinking 6 ounces, you're probably drinking enough if you're not really doing a lot of strenuous activity. You know, and 8 ounces of water is not going to hurt you. You're never going to be water toxic at drinking 8 ounces a day.
So is there such a thing of drinking too much water?
There is something. There is such a thing as drinking too much water, but it's a pathologic process. Yeah, it's a pathologic process.
Because a bottle of water is 16 ounces. I mean, the average bottle of water is 16 ounces. So, are we good? Okay. You gonna catch a plane?
It's not mine. It's not me.
You was looking to your left. We was wondering what you was looking at.
Well, Ken says, do you think American people could ever sue the manufacturers that sell us unhealthy foods?
I think if they let John Kennedy, the Kennedy guy, get in there and do his thing, I think it's going to come to that. Robert, yeah, it's going to come to that because he's going to go after them. He's going to go after the manufacturers. And people can talk bad about him all they want. This guy is on the right trail in terms of what they're feeding us, in terms of what they're feeding us, how they're treating the animals, the dyes, the food thing. I'm not going to say he's on the right trail completely with all the vaccines and all that, but let me tell you this, he's going to make some changes. Because I'm going to say this is the only country, for instance, there are countries that do not allow you to drink Mountain Dew. Let's talk about it. There are countries where you cannot eat Skittles. There are countries, most countries will not allow you to inject any animal. I think this is the only country that allows us to put bovine steroids into an animal and feed it to the population. Mm-hmm. We're doing things in this country that no other country is doing. And let me say this, we're not even in the top 30 or 40% as a country when it comes to health. We spend more money on health than any other country, far more than any other country. And we're not in the top 10, the top 20, or the top 30 of industrialized countries.
Even put that.
There's something wrong.
You know, it's funny you say that because when I was in Israel and I got a bag of Cheetos, I'm like, this tastes funny. It didn't have the same taste as a bag of Cheetos here. It was like either it was missing something or that was the natural version and we're eating whatever, but it was like, it just tastes nasty.
Eating camels, bro.
It was St. Peter. It was St. Peter's Cheetos, not regular Cheetos. I've heard that smoked or charcoal grilled food is not good for you.
I can't say much about smoke because I really can't address that. But charcoal is absolutely awful. It will absolutely cause serious problems with you. I agree. That's 100% correct.
Whoa!
Here we go again.
On 4th of July, we're out there. Charcoal, chicken, and steak, and
killing yourself.
Is it the food or is it the charcoal?
Go say it, Doc. Say it, Doc.
Charcoal. It's the charcoal. It's what the charcoal is doing to the food. It's what the charcoal is doing to the food.
Them chemicals
charcoal food is not good. You should not be eating it. Now I'm going to say this, and this is a caveat for me on this. I think doing charcoal for 4th of July and your grandmama's celebration birthday or something like that is okay. 2 or 3 times a year. If anything is going to harm you doing it 2 or 3 times a year, your plan ain't worth a nickel anyway. You need to abandon your whole plan. If 2 or 3 times a year something's going to tear up your plan is raggedy already. Please God.
We got 5 minutes. We got 4 minutes. We got 4 minutes left. Raggedy.
Oh, it was already raggedy. This question was already answered. This is already answered.
I'm right.
That's your raggedy self from that grill.
Your thoughts on fertilized provisions food? I don't even know what that is. What is that?
It's Jamaican.
Fertilized precision? What?
It is not Jamaican. I would know what that is.
I don't know. I don't know. I can tell you this. What we know is this: when we look at plants and things where there's no fertilization, and what we're going to call organic, we just tend to do better. We tend to do much better than when
That's backyard food, right?
Say again.
Backyard food.
Yeah,
backyard
exactly.
food. Yeah.
But when you're putting all these fertilizers in with phosphate and all potash and all this stuff, it's not good for you. And that's why plants grow so large, and they look in the same thing with the what we're doing to animals. That's why animals are so large, and it's just not a natural thing. Let me show you. If you look at the Amish people, they don't live very long, but they don't die from chronic illnesses like most of us. Cancer is unheard of. Cancer is extremely low among the Amish because they grow their own food. Yeah, and they have their little chickens. Their little chickens about the size of my fist. The chickens you buy bigger than your head. Yeah.
But that's not a lie, because I worked on a chicken farm, and in 6 weeks,
I know.
it was a full-grown chicken in 6 weeks.
Wow.
Full-grown. Yep.
And the Amish chicken is this size. And there's no hormones, no antibiotics, no steroids, and the chicken is healthy, and they're not seeing cancer at the rate we're seeing cancer. Very, very low incidence. Now they die from trauma, falling off ladders and horses running them over and all kinds of things like that. But not
being
from
bored to death. Being bored to death. That happens too. Wow. But
hey, 2 minutes.
About a minute and a half out.
Boy.
This is entertaining.
So, Doc, what would be some parting words you would leave with our listening audience?
I'm going to say this. I don't care where we are in our state of health right now. I don't care where any of us are right now in our state of health. Number one, I'm going to say whatever state we're in, we should all be grateful for whatever that state is. But I think even where you are now, regardless of your age, you can still have impact. You can still have impact on your life, your health, and the future. But it's going to require, I think, more water. It's going to require fruits and vegetables, and it's clearly going to require staying away from these processed foods. And processed foods are anything that men have put their hands on to alter.
And raggedy charcoal.
Yeah, right. That too.
And no,
but I think I'm going to say one thing.
Or cord, or grits.
We are deficient. We are deficient in vitamin D, and we're deficient in magnesium. And everybody should have those two things checked. If you're not taking a supplement, you should have them checked. Vitamin D and magnesium. Praise God.
Dr. Neil, man, thank you so much for being with us. You gave us a wealth of information.
Yes, you did.
And this was good. We got to have you back do a part 2, because, we do have a topic when we're talking about later on, when we talked about you earlier about, we got to figure out how we're going to do that particular topic.
But we got to call him 2 hours before we get on the show so we can get to this computer stuff.
Well, I think now that he has it on his computer, he should be fine the next time. So Dr. Neil, stay on. We're about to hang up. So guys, stay with us next week. You just might hear us
say, "You're welcome." Okay, you're welcome.
You're welcome. All right,
Dr. Neil, stay on.
I was looking for the credits. Bye, everybody.